Fontanel in infants' parents who have just had a baby are afraid to handle and wash this area because they think it will damage their baby's head. Contrary to popular belief, the fontanel, which is considered a sensitive area that should not be touched, is extremely robust and acts as a protective helmet in head traumas. Unless it is hit very hard, it is not damaged by mild bumps. When the baby is born, the skull bones are not yet fully developed and have not taken their final shape. This flexible structure allows the bones to overlap and give flexibility to the skull, allowing the head to enter the birth canal during birth and making the birth easier. In addition, the separation and softness of the skull bones allows the brain to grow. Newborn babies have 6 fontanelles on their heads. The front fontanelle is the largest. It is felt in a diamond shape from the forehead to the back. It usually closes between 9 to 18 months. Sometimes it can take up to 24 months to close. The anterior fontanelle may rarely be closed at birth or close earlier than 9 months. In this case, the patency of the sutures and the growth of the head circumference should be carefully monitored. Abnormally large fontanelles with delayed closure may be seen in babies born prematurely or in babies whose growth was retarded in the womb. Sometimes the bones forming the skull fuse together earlier than normal and close the fontanelle. This is called also affects brain development, affecting vision and hearing problems, increased intracranial pressure, and developmental delays. This process needs to be differentiated from a normal baby with premature closure of the fontanelle. In case of dehydration, diarrhea, and vomiting, the fontanelle may collapse. In this case, the baby should be given enough water, fluid, immediately. Sometimes swelling of the fontanelle may occur. This can occur with meningitis, tumors, and hydrocephalus. It is normal to see a slight swelling of the fontanelle during crying, coughing, and vomiting. If the fontanelle protrudes more than it should, this indicates increased intracranial pressure and requires a medical examination.